We are finally getting the opportunity to voice our experiences in the highest offices and engage in policy making that serves all of us, not just half of the population. We have waited a long time for this, so now hear us roar. This election... Yes! Whoa! There you go. This election has delivered an outstanding result for women's representation across Parliament, an almost gender-balanced cabinet and our first female Chancellor. It's a really exciting time, and you may have also caught wind today that there is now the potential of the first female president, a woman of colour, in the US. What a year that would turn out to be. Feminist organisations are sometimes accused of over-celebrating successes, and 50-50 is mindful that it has taken over 100 years to get to 41%. It's not 50% yet.
We can no longer sustain an economy based on one sex doing paid work for which they gain kudos and the other half doing the unpaid work that makes such mansplaining possible. I say that, but also a warm welcome, of course, to all the men in the room. Delighted to see you here. And you can mansplain away here tonight. It's a safe space. Unfortunately, our biology, I'm not banging on about nothing, because our biology and unfair burden of care continues to penalise women unjustly. 12 years after a woman has her first baby, she'll be earning 20% less than her equivalent male colleague. A survey from the Fawcett Society last year found that 250,000 mothers with young children left their jobs because of the prohibitive costs of childcare. At the end of their working lives, women who've had children can expect a 20 to 30% pension reduction.
You know, we know 10% of women leave their jobs when they get to that menopause age. That is not good and that's not great. So we really do need to drive and change things. I know from there and working with a lot of people in this room, we have, created a consensus statement for sexual and reproductive health. We also have a policy, and they're on the table, with informed, heard and empowered, really trying to support the health services. We're making slight changes to improve efficiencies within the workforce. So what I would urge everyone to do today is listen to all these speakers, listen to the key messages, and make sure they live beyond this room. Let's really, really drive change. And I urge all the parliamentaries to work with your ministers. Let's get that women's voice heard, but let's stop this fragmented commissioning that we're doing.
I would put money on the fact that if a man suddenly started bleeding out of his penis, how much medical funding would there be? A lot! We really need to fix the diabolically long waiting time for a woman to see a consultant. They've risen 220% over the last 10 years, with gynae cancers at the bottom of the list. So that means some women in some areas are waiting over a year to see a specialist. That is the difference between a diagnosis where that woman can have treatment or where she needs palliative care. So it's not overdramatic to say that it is a matter of life and death. We need to invest more in education, making sure that our young girls are receiving proper and timely education. We mustn't shy away from those difficult subjects because they're going to learn it on TikTok anyway. We all know that really terrifying trend of people talking about hormones. So a lot of the girls are not taking contraception.
It was about fighting for women. It was about paying homage to the women who've gone before us, who had to put up and shut up. And it was about raising awareness for the women behind us who need to know that they are wonderful from the day they are born. And they can go to their grave wonderful. And they can work as long as they want to. And they can live full, active and lovely lives. And they mustn't let these little niggles and these little pains, they are not, I'm getting older, it doesn't come on its own. They are something that we can actually do something about. So every single woman who's come here as a new parliamentarian today, never be afraid to campaign on what you believe in. If you're passionate about it, you will make a difference. And every one of you that makes a difference makes a massive difference to the lives of not just women, but everyone right across the UK.
The UK has one of the largest female health gaps in the world and the largest in the G20. We are underrepresented in clinical trials. We often feel we have not been listened to properly by medical professionals, and the national state of maternity care is still too often poor. Nationally, women are waiting far too long for gynaecological treatment. According to the new NHS data, 600,000 women are on a waiting list for hospital-based gynaecological services, and almost 36 patients are waiting more than 1 year for an appointment. So the new government has got much to do. But I'm pleased that Labour has set an ambition to reverse the deeply concerning state of maternity care by training thousands of more midwives and health visitors and incentivising continuity of care for women across their pregnancy. It is welcome that the Health Secretary has also set an explicit target to end the black maternal mortality gap, which means black mothers in the United Kingdom are 4 times more likely to die than their white counterparts.
And I don't care what you do. I stand for parent governor, if that's what you want to do. Stand for your parish council, stand for your city council, stand for parliament, stand to be head of the UN. I don't care what you're standing for, but stand. And if you don't want to stand, find a woman that does and support her. Because I'm not going to tell you it's a nice experience. We get at least double the amount of abuse that our male colleagues do. And if you're a BME woman, it will be even more. And it's awful. I had police having to come to each and every one of my events because I had a man from the right fixated on me who, did hour-long Facebook Live interviews to rants to about 6 people, also on the far right, about how I was the worst person in the world and I should be taken down. Still does them. This is what you'll experience.
So my call for this government is don't forget the health visiting community. They are so important to so many parents around the country. I'm absolutely thrilled to be here today. It feels like the sort of a closing of a loop, Francis, to come back as part of the 50-50 team, but now to be sitting on those green benches. It is tough. If you're thinking about doing it, do grab one of us and I'll, get us to help you, work with 50-50. I remember when I stood the first time, actually it was women that made life more difficult for me. So please don't be the woman who said to me that I would be letting my children down if I went to Parliament. And don't be that woman, a different one, but of the same generation, sadly, who said to my husband that it was outrageous that I was leaving him to look after the children.
In fact, there's so many people here that we work together with, and it means that we make change happen more quickly and more efficiently. But by raising all these issues in Parliament and directly to ministers, you can make a real difference for women and girls, whoever they are, wherever they're from. And that's really important because we need to bring down waiting times for women's health and make sure that all healthcare professionals, at whatever level they are, know everything they need to know about women's health, and they understand the different approaches needed to reach diverse communities, because that is really important.
Access to contraception health advice is vital, but too many women just aren't able to access the services that they need, and too often they end up putting off treatment. We've heard before, this is what women do. If it's too difficult, too complicated, we put ourselves at the bottom of the list and we just don't chase it. And not getting the health care profoundly affects women's lives, not just in terms of fertility and pregnancy and family, but in every ambition, in their work, in their education, in every aspect of our lives. But unfortunately, too many women have very poor reproductive health. There's a growing unmet need for contraception. About 45% of pregnancies in Britain are unplanned or ambivalent. And you might say, well, why does that matter? But it matters because we know that the health of a woman before she conceives affects the health of her child all the way through its life. And it affects her health as well. So actually planning pregnancies is really important.
However, the maternity services are doing such an amazing job, and we must remember that we do have one of the lowest maternal mortality outcomes in Europe, actually in the country, compared to America as well. You would be shocked. Where the problem is where we see the disparities when we look through the lens of race or other inequalities, and we must work towards reducing that. We do have a problem with our gynae waiting list. We do have 660,000 women waiting. This is a problem that I come up against time and time again when I come to perform an operating list and find that my operating list has been cancelled. And often the women's health operating lists are the first to be cancelled in a hospital. This is unacceptable. Partly it's because there are not enough women in the executive board to be able to push back and to have our voices heard. So to challenge that, all of us have voices, women and men, we need to make our voices heard.